So without further ado, let's get started. I'm going to share my screen. And when I do, I think I'm going to do a really crappy job at looking at the chat. So if you have any questions for me, feel free to put them in the chat and we can get to them later on. We have plenty of time for questions, or also please just interrupt me. I have an Italian family. I've been interrupted my entire life. So I don't mind. Just jump right in. We'll keep it casual and interactive. Okay. So without further ado, can y'all see this?
Yeah, it looks good.
Okay, good. Great. So we're talking about acupuncture in integrative veterinary care, and I just kind of want to stop and pause on that word real quick as we get going. What do we mean when we say integrative veterinary care? When I think of integrative care, I really just kind of, in most basic terms, think of best of East meets West. So most of my patients are also getting some kind of Western veterinary support, which, when we say Western medicine, that's basically like the traditional veterinary medicine that most people are familiar with in the United States in 2025. And when I say Eastern medicine, I'm talking about Chinese medicine, which includes acupuncture, Chinese herbal medicine, and other modalities as well. And today we're going to focus on acupuncture primarily.
Oh, cute.
So what is acupuncture? And you're going to see all of my slides are peppered with photos of my very handsome and beautiful patients. So this orange tabby is Toulouse. He is 11 years old. I've been treating him since the spring after he had a seizure. And as you can see, as he sits there in the bottom of his carrier, he's a perfect little acupuncture patient. So acupuncture, in most basic definition, is the insertion of tiny sterile needles at strategic points on the body to achieve a healing effect. And in Chinese medicine, we have a different way of describing disease in the body. We sort of understand disease as an imbalance of energy in the body. And we recognize that it's the body's natural tendency to want to be in balance. We know that, the body has very finely tuned ways of maintaining balance or homeostasis among its symptoms. And so acupuncture works with the body's natural tendency to want to be in balance, to sort of nudge the body toward healing when it's out of balance. It supports circulation, and it generally assists in the healing process. Okay, so acupuncture is ancient, and we'll talk about that a little bit more in a slide or two. But we can use our Western veterinary understanding of biology to describe sort of how it works, what is happening in the body when acupuncture needles are inserted. And our model on this slide is my patient Rex, very handsome senior German Shepherd who was rescued from Oakland Animal Services. He started seeing us when he had hind end weakness. Really, he was essentially unable to walk due to a back issue called intervertebral disc disease. And so he was getting regular acupuncture as a part of his recovery from that, and while he was regaining his ability to walk. So when acupuncture needles are inserted, we know that they stimulate nerves, muscles, and connective tissue. They increase blood circulation, not only in the local area where the needle is inserted, but actually they have a function of improving circulation systemically throughout the body as well. We know that acupuncture stimulates the release of neurotransmitters such as endorphins that aid in pain control. Acupuncture stimulates the production of cortisol, which helps control inflammation in the body. And, sort of generally speaking, based on the understanding that we have so far of what acupuncture needles do, and there's a lot of research that's still ongoing, it has very sophisticated interaction with our nervous system. Acupuncture is able to modulate numerous different pain stimulating pathways in the nervous system simultaneously in this really kind of adaptogenic way, which is just not something that like Western painkiller drugs are able to do. And that's not to say there's no place for Western painkillers. Often we'll use both simultaneously, but this is something that's special about how acupuncture can help with pain modulation in the body. Does anyone have any questions at this point before we move on?
Quite clear.
Okay. So now I'm going to give you the world's shortest history of animal acupuncture. We know that acupuncture for humans has been around for at least 3,000 years. I feel like every few months you see a new news article where they like open the tomb of a mummy and find even more ancient acupuncture tools in it. But we know it's at least a few thousand years old. And the earliest evidence of animal acupuncture is from around 930 BCE, so also very ancient. And so in China, these earliest texts about acupuncture for animals focused on horses. And the reason for that is pretty clear when you consider that horses were a really important part of China's military at the time. And so they wanted to, bring the best medicine that they had available to keep their horses healthy as a part of keeping their military might strong. And to provide a little comparison, we don't really see anything resembling our modern Western veterinary medicine until the 16th century. And the first veterinary college in the Western world was founded in France in 1762. So, this is all just to say, I think because a lot of people aren't familiar with acupuncture for animals, they may have the mistaken impression that, someone just invented it like 10 years ago or 20 years ago. But that's not the case. Acupuncture for animals has been around for thousands of years, and it's proven to be remarkably safe and effective. Okay. So one question that I am often asked is, what can acupuncture treat? Our model here is my patient, Baxter, who has no teeth and who is my boyfriend. I think I'm going to be seeing him tomorrow, actually. Baxter comes to me for support for seizure disorders and mobility. He's a senior Chihuahua-esque dog. So I've listed some of the conditions that I will see animals most commonly for at Marina Village Vet. And these include neurological conditions, injury recovery. I would also put post-surgical recovery in that category. Side effects of cancer treatment, kidney disease, dermatologic conditions, intervertebral disc disease, which is what my patient Rex was dealing with, also known as IVDD, pretty common issue with dogs and some cats as well. Digestive issues, osteoarthritis, very, very common among dogs and cats over a certain age, and hip dysplasia. And you'll note that, we've listed sort of some of the, just like with humans, the entry point for many people to acupuncture is pain, like my back hurts, right? But acupuncture is very effective at dealing with musculoskeletal pain. We can also treat internal medical conditions quite effectively with acupuncture. Dr. Ashley, was there anything you kind of wanted to add to that point right now?
Yeah, you mentioned renal disease. I think that's a really big one. It's a it's part of the low hanging fruit in my mind, in addition to osteoarthritis pain, because the kidney system seems to respond extraordinarily well to acupuncture points along the bladder meridian, for example. And these cats and our older dogs who have renal degenerative issues, who aren't well hydrated, do very, very well with routine acupuncture. So I'm glad you highlighted that. Um, Other common conditions which Western medicine sometimes has difficulty managing, I would offer as really great opportunities for acupuncture to shine, inclusive of cortisol disruption, so hyperadrenocorticism or Cushing's disease in dogs and cats. Diabetes has a place where acupuncture can also be of service. So those are the common ones I can think of. Thanks, Lisa.
Great. And this is not like an exhaustive list, certainly, but these are some commonly treated, I would say. Okay, so on this slide, I've included I'm taking you all to Chinese medicine school for a mercifully short 2 minutes. And this is a quote from the Yellow Emperor's Classic of Medicine, which is one of our most important classical texts in Chinese medicine. The text itself is at least 2,000 years old. And the reason I've included it in this slide is because a lot of people approach acupuncture kind of as a medicine of last resort. Like, well, we've tried everything else and now my dog is like really, really sick. So I guess we'll try acupuncture now, like the Hail Mary pass, right? But I really want to emphasize how beneficial acupuncture can be before your dog or cat is sick, before your dog or cat is in a lot of pain, because preventative care is really a cornerstone of traditional Chinese medicine. And so I'll just read this quote to you really quickly. It says, to administer medicines to diseases which have already developed and to suppress revolts which have already developed is comparable to the behavior of those persons who begin to dig a well after they have become thirsty, and of those who begin to cast weapons after they have already engaged in battle. So what does this mean? It means that ideally we take action before there's a big problem, right? We don't wait until we're thirsty to dig the well. We don't wait until our dog is in so much pain that he no longer wants to go out for his after dinner walk in the evening before we bring him in for supportive care, including for many animals, acupuncture. Acupuncture, it brings the body into an optimal state for healing, and it can prevent a lot of problems before they arise or decrease their severity. And there's some good research around this with arthritis in particular. Dr. Ashley, was there anything you wanted to add along those lines at this point?
Yeah, I think the nice success is that for a lot of our clients, seeing what we see is hard and some damn near impossible. So if you've got good video or pictures of, for example, early or middle-aged dogs who may have hip dysplasia or elbow pain, and you can do the transition, sit down, stay, stand with them, and you send them to your veterinarian, they can be of service to give you some ideas where movement abnormalities will occur that don't necessarily manifest as lethargy, reluctance to stand, get up, go up the stairs. Like, that's way fucking late. So the early stuff that Lisa's talking about, sometimes we don't appreciate because we don't have an educated eye yet, but your veterinarian can do that. Or, dog trainers have great eyes, horse people have great eyes. There are lots of people who are not veterinary medical professionals who do see lameness in a subtle way, just in the arthritis camp. So those are great opportunities to be curious and ask questions about, is this normal or not, and then get some clarification. And if it's early stuff, like Lisa's saying, simple radiographs, simple, nice physical exam will get you a long way. And then that can be directed towards a nice opportunity for Lisa to work with those patients and then maybe avoid the anti-inflammatories, right? Avoid the gabapentins, the amantadines, the ketamines of the world before we, it's nice. So that's a really, really super great tool.
Thanks, Dr. Ashley. Okay, so let's talk a little bit about what to expect at your animal's first acupuncture treatment if you have never had an animal get acupuncture before. And I know some of the folks who are here have had animals get acupuncture, so you can feel free to include your experience too if you're so inclined. I'll just start by telling you the very quick story of the photo on this slide because I love it so much. So the tuxedo kitty Tux is my patient in this photo. He's a young cat, about a year and a half old. He had chronic, like idiopathic cystitis. He kept getting urinary tract blockages, which can be quite serious for cats. So he started getting regular acupuncture. He also takes a Chinese herbal formula. He's been doing great. But when he would come for his acupuncture treatments, his mom would also bring Angel Pup, who's the dog you see next to him, who's their dog at home. And she called him Tux's emotional support dog. And Tux was just much more comfortable when Angel was with him. So their treatments looked much like you see in this photo. Angel Pup would just lay down on the mat on the floor of my office, and Tux would just hang out next to her during his acupuncture treatment. It was really, really sweet. So at your first appointment, we're going to spend a lot of time talking about your animal, and that's typical at any kind of first veterinary appointment. But one thing that is a little different from a Chinese medicine approach is that we're always sort of taking a holistic look at your animal. So even if you bring your animal in because they hurt their knee, or they have a skin rash or something very specific, I'm still always going to ask about their digestion. I'm going to ask about their poop. I'm going to ask about their appetite. I'm going to ask about their temperament, because all of these factors play a role in how we're going to figure out what is the optimal treatment, what acupuncture points are we going to use for your animal, because the underlying imbalances that cause one animal's indigestion may be totally different than the underlying causes that are causing another animal's digestive upset. So by asking these sort of holistic questions, really help kind of figure out what's the best way to provide care for your animal. At my treatments, I typically like to start, depending on how receptive your animal is to being handled. I typically like to start with a Chinese style of body work called Tui Na, which, kind of similar. You may have heard of Japanese shiatsu. Tui Na is a Chinese style of body work. And there are just some very simple moves that I like to teach you to be able to do with your own dog or cat at home, so they can get some good therapeutic treatment at home between their treatments with me at the office. And it's just a nice way to help them get a little bit relaxed before their acupuncture. Again, it kind of, depends on the animal. Animals that really don't like to be handled, I may not do as much massage with, obviously. But we always want to make sure that your animal is as comfortable as possible during the treatment. So most dogs I'm treating on a mat, often with a blanket, just on the floor, like you see Angel Pup and Tux here. Confident cats I may treat on the floor. A lot of cats are most comfortable being treated inside their carrier. So like you saw with Toulouse, the orange kitty in my earlier slide, it was a carrier where the whole top comes off, and we just popped off the whole top of it, and let him hang out inside of his carrier during his treatment. So depending on your animal, we find a way to make them comfortable. For dogs who require or do best with some distraction, who are really food motivated, lots of times we can have a treat on a licky mat for them. I even have I have a couple patients who will even feed their dogs their breakfast or dinner at their acupuncture appointment. They'll just either schedule my first appointment in the morning or my last appointment at the end of the day and put their wet food in a licky mat, and their dog will eat his breakfast while he's getting his acupuncture treatment. So we try to make it work so it's as enjoyable an experience as possible for your animal. I will sometimes incorporate other treatments into other kinds of treatment into an acupuncture treatment. There's another modality in Chinese medicine called moxibustion, or moxa for short, which is a way of stimulating acupuncture points with heat. I do that with a lot of my animals, depending on the condition that they're dealing with. Many of my animals also my patients also get cold laser therapy as well as part of their treatment. So that's a modern Western intervention that we'll incorporate into their holistic treatment sometimes. You'll often see with animals that when you see photos of animals who have gotten acupuncture, we are often going to treat points on their back, on either side of their spine. There are a variety of reasons for this. This is a part of an animal's body that is most accessible to us and less disruptive to them. They often can't see the needles there. And I typically find that usually animals tolerate the sensation of needling really, really well. And the ones who get reactive to it, it's like, if they happen to see a needle, then they're like, oh, what the hell is that? So depending on the animal, we'll think about placing needles in places where they're just not able to see them. And from a Chinese medicine perspective, there are a lot of important points on either side of the spine. This is the case for non-human animals and for humans as well. And the reason for this sort of makes a lot of sense when you consider that this is where nerves going in and out of the spinal column are bringing information to and from the brain. So there are important points that have systemic effects on all of the body's organ systems located along the animal's back. But that said, we do points on the head, points on the arms, and I would say arms and legs. I would say typically, there's no general rule, but I would say typically during one treatment, I will use maybe 6 to 12 needles on an animal. More's not better necessarily. You're not getting less of a treatment. If your animal only gets 6 needles in a treatment, it's just a different treatment than a treatment with more needles. And I'm gonna talk a little bit about treatment plans for your animals, sort of what an acupuncture treatment plan looks like and why we have them. But maybe I'll just stop here again and see if anybody has any questions before I move on. Okay, I'll move on for now. So your animal's going to get a treatment plan. Acupuncture I don't want to say never, but like almost never is acupuncture going to be a one and done enterprise. I've been thinking about acupuncture as like physical therapy for the nervous system. And we know that with physical therapy, you don't just do the exercises once and now you're better. If your veterinarian prescribes antibiotics for your animal, you don't just give them one dose and now they're better. Like both of those, kinds of treatments, the benefit of acupuncture is cumulative, and each treatment builds on the one before it. So typically when I first start working with an animal, we kind of front load a series of treatments, which is a way to really kind of get the body shifting in the direction that we want it to shift. And that will often be something like acupuncture once a week or as close to once a week as you're able to swing for 4 to 8 weeks. And then we can kind of reassess. And I'll give you some examples of what some specific treatment plans look like with some studies of some particular animal patients of mine. So the first patient I want to talk about with you today is Harley. Harley is a 1-year-old cat, and I first started seeing her right after the new year in 2025. So just the beginning of this year. She had run out of her house and ran into the street, and she was hit by a car. And her tail was completely paralyzed as a result of that injury. She had a fractured sacrum, an SI joint subluxation, and a misalignment between her sacrum and her tail, among some other more minor injuries to her hind end. So her parents took her straight to the emergency vet, not to the acupuncturist. That's what you do when your animal's been hit by a car. You take them to the ER. That was appropriate. At that ER, they told them that, well, the only thing that they really had to offer offer Harley at that point, other than like painkillers and anti-inflammatories, was that at some point they could do an amputation of her tail because her tail was totally paralyzed at that point. Luckily for Harley, both of her parents had a lot of personal experience with acupuncture. They also had another cat previously who had gotten treatment with acupuncture. And so they asked the vet if it would be appropriate for them to try acupuncture with Harley. And the vet said, go for it. So I first started treating Harley 10 days after she was hit by a car. And I like to emphasize that because it's really rare that I get the opportunity to start working with an animal so quickly after an injury. And especially when there is a neurological component to the injury, the sooner we start treating them with acupuncture, the better the outcome in many, many cases. Her parents understood that we might not see improvement for a couple of treatments. They were totally on board with providing consistent care and really investing in trying to see if acupuncture was going to help Harley. There were 0 improvements after her first few treatments. We didn't see any change in her tail. Her parents were not discouraged. They had faith in the process. And after her 4th treatment, just the very 1 inch of her tail that was close to her body started coming back online. She was starting to get some control over that. And then after that, each successive week for her first 7 weeks, for the 4 weeks after that, she was getting significant improvement weekly after each treatment until after her 7th treatment, her tail was back to near 100% mobility. I wish I had a before. I have after video of her tail. I wish I had taken before video of her tail too, but you'll just have to trust me. So Harley's treatment was that she got 9 weeks of acupuncture every week. She then got 3 more treatments that were spaced out a little bit further. And this is sort of like a typical transition to a maintenance schedule. And now, Harley's a young cat. Her tail is working fine. We know that whenever there is some kind of injury to a joint like this, there's going to be a high susceptibility for osteoarthritis to develop in that joint as they get older. So Harley's now on what we're considering her preventative / maintenance care now. And she's coming to see me once every 3 months just so we can keep supporting that tail and keep it from becoming painful as she gets older. Okay, so our next poster boy is Walter. It's not totally obvious from this slide, but Walter weighs 46 pounds. He's an unknown breed mix, but we're pretty sure he's either an extremely large dachshund or a harbor seal. Walter is 4 years old, and he was seeing me for back pain due to a flare-up of intervertebral disc disease. I think I spelled disc wrong here. Sorry about that. IVDD is very common in dachshunds and other dogs with this body shape kind of like a dachshund with long backs and short legs. It's not limited to dogs of that body shape, but we're always going to be on the lookout for that as a potential future issue when we see a dachshund or a dog with a similar body shape. So Walter is only 4. He had an acute pain flare that made him difficult for him to go up and down stairs and to get on and off furniture without pain. He didn't want to move his head and neck at all. And he was started first on carprofen and gabapentin, so painkillers essentially. And he did improve for a couple of weeks, but then his pain seemed to flare up again, at which point his guardian brought him in for his first acupuncture visit. And we knew from x-rays that Walter has this intervertebral disc disease throughout his spine. So Walter came to see me 4 weeks in a row. After 2 treatments, he had significant improvement, and he had what his guardian described as 100% improvement after 4 treatments. So for Walter, because he has intervertebral disc disease, he's always going to have a susceptibility to future flare-ups. I want to do more frequent preventative care for him. And I've recommended ongoing maintenance, ideally getting treatment once a month. His family just relocated to Louisiana, so I helped them find a vet out there who is trained in acupuncture so he can keep getting his care out there. And then just one more animal who I'll mention. This is Hazel. Hazel is a golden girl. She is 18 years old, and she was diagnosed with small cell lymphoma a little over 3 years ago. She also has pretty significant osteoarthritis in her elbows and her back and her hips, and as we would absolutely expect in any cat of her age. So she actually, do you want to jump in, Dr. Ashley? Because I know you sort of have a longer history with Hazel before I started treating her with acupuncture.
Yeah, so just before Dr. Lisa got with her, she'd been in my care intermittently over the course of that time period from first diagnosis to present day. And her owner had had noticed that she wasn't doing well on the standard kind of anti-inflammatory immunosuppressive treatments that go along well, typically for the average cat who has lymphoma. So mom stopped a lot of the Western meds that weren't otherwise jiving with her system, and subsequently wasn't giving her body support in any other capacity. So she'd have nausea, she had weight loss, her coat looked like crap. And then, it's over the course of a few sessions of appointments, we discussed how acupuncture might be of service to her. And indeed, as Dr. Lisa will share, she did thrive with acupuncture treatment. I think it's important for us all to recognize, and Hazel highlights a few things here. 1, nothing is a panacea. 2, we have to be curious about our individual patients, our furry family members, and be advocates for their care if something is not going right, not set it and forget it mentality, and continue to ask questions, and maybe something will stimulate another solution. And I think this particular individual has really benefited from acupuncture because Western medicine was more or less failing her in many, many ways. Lisa, you want to pick it up?
Yeah, so Hazel is still with us. And she is an example of a client who her acupuncture schedule is just every other week ongoing. It's not going to be spaced out further than that. Her guardian in the past, there have been times where she didn't get acupuncture every 2 weeks, and there was a notable decline in Hazel's condition, either with increased vomiting or also just increased meowing, which is a pain signal from Hazel. So, there have even been times where I've wanted to see Hazel weekly when she's kind of had a little bit of a lapse in her wellness to sort of get her back up to speed. But Hazel's treatment plan is essentially weekly or every other week acupuncture from now on, to keep her feeling as good as we can. So just kind of wanted to give you folks some examples of what some different kinds of treatment plans will look like, and what follow-up care looks like with animals with different kinds of conditions. And that is really it for me. I just have a few more photos of some of my animal buddies here. You've already met Tux, the kitty with the idiopathic cystitis. On the left is Bentley. I was seeing him for recovery from CCL, which is like a knee injury. He was a very good patient. He's an example of one of my patients who enjoyed eating food during his treatments. He was a very healthy eater, and I once watched his dad feed him an entire bag of frozen vegetables during his acupuncture treatment. So we definitely brought the mop into my office after that treatment of Bentley's. And this guy in the middle is Monk. He's a rescue dog who has had cancer and has really bad arthritis and kind of a million things wrong with him. And he's just a big bro and just like the happiest dog you ever want to meet, and does really, really well with acupuncture and is able to go on much longer walks than he had been for a couple of years, his guardian reports. So that's all from me. I'm going to stop the share now. I realized I forgot to put my contact information on the slide. So I'm just going to put my contact info in the chat for you now too, in case anyone has any follow-up questions for me. I invite you to shoot me an email anytime.
Lisa, I'll throw Jack out in front and center here because I know him well. So he's got Luna by his side. She's a young, vibrant canine individual, and who may later on in life develop some osteoarthritis, but her predominant issue that is very well maintained now is a lower limb wrist kind of consideration, where she had some strains earlier that she's now recovered from. So would you care to share some of your tips and tricks for managing these cases, which are a bit more regionally difficult to needle, and how you might otherwise work with those patients, both, centrally?
Just come over to listen now.
Oh, good job, Luna. So I think if you could chat a little bit about regional acupuncture, but also kind of how you treat the whole body, and what other modalities you might employ for an individual who's got areas in the body that might not be as accessible to needling, if that's the
can
case.
I just add one thing? Because I was also, I've been giving her Adequan, the shots, and the Dasequin supplement. And so I'm sometimes thinking that the work that we're doing on her weak wrist may be benefiting all the joints in her body, just sort of as a side effect. So if you could also address, if we're addressing the one joint, is it maybe we address them all? You see what I mean? It's kind of like, would that help other things, or should we do them all, or what's the story there?
Yeah, so I just want to say yes as the answer to your question, but
Very good. Okay, great.
I'll elaborate on that. So, you know, Dr. Ashley's describing, you know, a lot of dogs don't love to have their paws touched. And so for some animals, if there is an injury to a wrist, it's not really feasible to do acupuncture like at the site of the injury.
She would tolerate it. She's no problem with being handled and manipulated and all that.
Great. Yeah. And some animals do tolerate it totally fine. In which case unless it's like a very recent injury, maybe I wouldn't needle it like 2 days after it happened. But an older injury, I'm definitely going to do needles around the area of injury, to help support that. But when that's not feasible, other things that we can do locally, I'll often recommend cold laser treatment, which is a kind of red light therapy. You might also have heard it called photobiomodulation. Red light therapy has some of the same effects that acupuncture has. We know it stimulates photoreceptors in the cells and increases ATP production. It basically like increases the rate at which healthy cells are created in that area. And especially when there's an older injury, you know, the body has a tendency to heal things like maybe 75% of the way, and then kind of wall it off with scar tissue and like forget about it. And so what acupuncture is doing, what red light therapy is doing, is like going back to that site and like reminding the body, you're not done healing this yet. We still need good circulation in this area. We still want to keep healing this area of the body. There are also always points that we're going, I won't say always, but there are often points that we're going to use that have a systemic function of helping with injury recovery. There are points that have a systemic function for supporting the tendons and ligaments of the body. There are points that have systemic function for supporting the bones we describe it as the kidney system in Chinese medicine, which is not the same as your anatomical kidneys, but it's the terminology we use in Chinese medicine. There are points that have a systemic function of moving blood, we say in Chinese medicine, which is supporting circulation and also helping with pain relief. So even if, you know, there is like a localized injury on a part of your dog or cat's body where it doesn't want to be touched, there are still a number of different approaches that we can take to help treat that injury. And so, Jack, to your question about like, well, are we ever just treating someone's left wrist? Like in Chinese medicine, no, you're never just treating someone's left wrist. You're always also identifying what is the root imbalance underlying this injury or that has arisen as a result of this injury, and how can we help address that? And that is going to have like a holistic effect for
Great. Thank you. Thank you.
Any other questions you guys have? I'll happily throw other people under the bus too. Lisa, do you find with any of the species that you work with any particularly non-responder individuals or super responder individuals that you've come across?
Oh gosh.
See.
Yeah, on an individual basis, yes. I mean, there are always some animals, both cats and dogs, who show significant improvement after 1 or 2 treatments. And I always tell people, don't expect that. Like, I would rather underpromise and over-deliver. And getting significant improvement after 1 or 2 treatments really isn't typical. But sometimes we see it. There's a dog I've been treating who she had low back pain, but really her guardians primary concern was that she was having bowel incontinence almost every night for a couple of weeks. And she'd had a little bowel incontinence prior to that, but it had really escalated. And so I started treating her with acupuncture and herbal medicine. She improved pretty dramatically. I think she only had one bowel accident in the first week following her one treatment. And after the second treatment, it was the same. She only had one bowel accident. So that was like a faster improvement than I would promise, especially to someone who's dealing with cleaning up their dog's poop when they wake up every morning, because I really don't want to disappoint that person by giving them unrealistic expectations. But yeah, some animals just respond more quickly, but I couldn't generalize for like a particular condition or species.
There's no hard and fast evidence to back up what I'm going to say next, so take it with a grain of salt. But the equine patient seems particularly responsive. Their life is lived in a fight or flight mode, and much of the experience that I've personally had or come across with others is quite dramatic with respect to that species as a whole, because of the endorphin release that you can profoundly get. Now, some don't love it, but it's always such it tickles your fancy, because most horses are quite good responders.
That's so cool. Anyone else have any questions? I know we're getting close to 8. I don't have to leave at 8, but I want to be respectful of people's time.
I was just curious on the dermatologic conditions that you can treat. Does acupuncture ever help with like chronic ear infections or yeast or anything like that?
Yeah, I want to say yes and to that question. I definitely have patients who have gotten good improvement from acupuncture, and also Chinese herbal medicine can be an important component of that, sort of depending on the underlying cause. If there's an allergic component underlying the infection, we always want to take a look at food. I always think about food with dermatological conditions, because frankly, if your animal's if the underlying issue is an allergic response to food, I really think you're throwing your money away bringing them to me for acupuncture if you're not changing their food. So this is sort of like part of the holistic approach that we're taking. Nutrition is part of it. And maybe, maybe allergies are not a component, or maybe that's like something that we could explore together in the course of treating your animal. But yeah, I have a dog I'm treating right now. I started treating him 2 weeks ago, and his mom actually brought him twice a week for the last 2 weeks. He had been having a persistent ear infection, which has totally cleared up. Now he got a negative bacterial swab on Monday, and is not scratching anymore. So yeah, acupuncture and Chinese herbs as well can be helpful. That said, like as with humans, dermatological issues are tricky. That's what, like, Western medicine doesn't have great stuff for dermatology either, right? And it's a lot of like throwing spaghetti at the wall and seeing what sticks. So for dermatological issues in particular, I really advise people, like, this probably isn't going to be better in 2 weeks. Like we're going to be invested in a course of treatment here to see if we can move the needle on this.
And to add to that, Lisa, even on the Western side, all Western medicine is doing, if you're not treating underlying stimulation, is suppressing symptoms. I mean, whether it's with a fancy dog specific JAK kinase receptor antagonist, or something else or steroids, God forbid, it's not actually fundamentally changing how the immune system talks to the individual patient. So, food allergies, work with herbs with Dr. Lisa. I mean, it's just so much better in that regard. If we can address some of the primary triggers, you'll still manage the patient just like we do in people, but much more successful long-term benefits.
Anyone else? Dawn, do you have all the information you need to make sure everyone who's here is entered in the raffle for a animal acupuncture treatment?
If she's not online, I've got names, Lisa, so we can sort it out. We're good.
Okay, perfect. I think she's just muted. Well, thank you all so much for coming out. It's great to see some familiar faces and to meet some new folks. My email's in the chat. If you have any questions for me, please don't hesitate to reach out at any time.
Could I ask just one final quick question?
Yeah.
It seems that acupuncture might be one of the few modalities of treatment that doesn't seem to have much risk involved. Is that true?
I would agree if it's done by an experienced
Right.
practitioner.
Given that as a premise. Yes.
Yeah, certainly. Yeah, we don't think about, I once heard someone say there's no such thing as side effects. There's just effects, and some of them we want and some of them
Okay.
we don't want,
Okay,
right?
that's interesting.
But
All right.
it's not we don't worry about like unintended side effects.
All right. Okay.
Undesirable side effects with acupuncture in the way that we do with, say, certain drugs.
Sure. Very important point. Okay, great. Thank you.
Well, thank you all so much.
Thank you.
Thank you, Dr. Lisa, for your time. Thanks everybody for
Thank
joining
you.
us.
Lisa, nice job.
Spread the good word. It's a fabulous modality. Fabulous.
Thank you.
Thank you.
Hey, thanks a lot. See you later. Bye-bye. Thanks again. Bye-bye.
Bye, Danny. Bye, Tara.
Thanks, Jack. You're so lovely.
Thank you. Thank you. Thank you guys. Thank you so
Thanks,
much.
Tara.
Yeah, Luna's very excited to come in now. I'm not kidding. She really is. You can't see her, it's too dark, but she's really quite.
There she is.
Very excited.
Okay, see you later. Have a nice evening. Thanks so much. Appreciate it. Bye-bye.
Thanks, Jack. Good
Bye.
night. Thanks, Luna. Thanks, Tara. Awesome. All right. Anything else, Miss Lisa, that I can do for you? I'll check in with Dawn. If
I'll
you
stop the recording.